Nurse Clara Jensen was a dedicated and hardworking member of the surgical team. Colleagues often noted her meticulous attention to detail and her willingness to stay after hours to comfort patients or assist in late-night procedures. But behind her calm exterior, Clara harbored a deep resentment for her colleague, Nurse Rachel Carter. Rachel was younger, full of energy, and had a magnetic charisma that drew people in, including Dr. Nathaniel Brooks, the respected and somewhat aloof department head. Clara had worked alongside Dr. Brooks for years. She had imagined a future with him, misinterpreting his professionalism for affection. When Rachel joined the team and effortlessly captured Dr. Brooks's attention, Clara's envy blossomed into obsession. At first, Clara tried to brush off the feelings. But every shared laugh, every subtle glance between Rachel and Dr. Brooks chipped away at her composure. The idea that Rachel was stealing what was rightfully hers festered, and soon Clara's thoughts turned sinister. The opportunity came one quiet evening in the recovery ward. Clara was the senior nurse on duty, giving her full access to the medication room. Rachel had just received a new patient, Sarah Miller, a 24-year-old woman recovering from a traumatic car accident. Sarah was stable after surgery but remained vulnerable. Her care required precision and attention. Rachel had taken a particular interest in Sarah's well-being, checking on her frequently and offering comforting words. As she stepped away to retrieve a fresh syringe, Clara seized her moment. She entered the medication room, her heart pounding but her hands steady. She swapped the syringe containing a standard post-operative sedative with one filled with a powerful dose of muscle relaxant. The dosage was lethal for someone in Sarah's condition. Clara's medical knowledge made her actions chillingly precise. She knew the drug would slow Sarah's respiration and heart rate. It would mimic natural complications, and Rachel, who would unknowingly administer it, would be the one questioned. When Rachel returned and injected the medication, Sarah's vitals began to plummet. Alarms blared. Rachel reacted immediately, trying to reverse the effects. The medical team scrambled, but it was too late. Sarah Miller died in the recovery ward. Rachel was devastated. She questioned herself endlessly. Had she made a mistake? Her confidence wavered as hospital administrators launched an investigation. Clara played her role well. Concerned, supportive, subtly suggesting that perhaps Rachel had been distracted. But the hospital's internal review team wasn't so easily misled. Rachel had an impeccable track record. Her procedures that night had followed protocol. Security footage revealed something odd. Clara had entered the medication room moments before the syringe was used. A forensic sweep uncovered Clara's fingerprints on the tray containing the altered medication. Further digging into Clara's work computer and personal messages unveiled emails and chat logs with Dr. Brooks. In them, Clara subtly undermined Rachel, complaining about her recklessness and expressing frustration over how Rachel was always in the spotlight. The messages painted a picture of a woman consumed by jealousy. Dr. Brooks was shaken. He had always respected Clara, even confided in her during stressful times. But he had never seen her as more than a colleague. The revelation of her feelings and manipulation stunned him, especially when he realized how his unintentional favoritism may have fueled the situation. Clara's efforts to frame Rachel unraveled swiftly. Her attempt to delete security logs failed, and another nurse recalled seeing Clara loitering near Sarah's room just before the incident. In the end, Clara was arrested and charged with the murder of Sarah Miller. Rachel was cleared of all wrongdoing, though the trauma of that night stayed with her. Dr. Brooks testified in court, describing Clara's demeanor and the troubling messages she had sent. Clara Jensen had let envy consume her, leading to a calculated and cold-blooded act. A life was lost, and a career nearly destroyed, all because of a deadly cocktail of jealousy, obsession, and betrayal hiding behind the mask of professionalism. Sarah Miller never knew the storm brewing around her. She was simply a patient, caught in a web of desire and resentment that had nothing to do with her, yet ultimately claimed her life.